Today, I wanted to kind of talk about a subject that women may have heard in passing at some point, or maybe from their physicians, or maybe they're aware of this particular topic. But I want to talk about vaginal lubricants or moisturizers in particular, and just some scenarios of why we would use a vaginal lubricant or moisturizer, and also the benefits of using them. Basically, our body goes throughout kind of the whole cycle of our reproductive years. We go through a lot of different hormonal shifts. Starting our periods, one of them. Pregnancy, postpartum phase is another, and then eventually we go through menopause. So our vaginal lubrication changes depending on what phase we are in. It depends also on where we are with our menstrual cycle, what age we are, arousal, influence of hormones on the body, of course. Of course, the vagina is a very acidic environment, so sometimes we want to make sure that pH balance is normal as well. And so sometimes when that is off, it also can disrupt the natural lubrication. So talking about the difference between moisturizers and lubricants. So moisturizers are meant to be absorbed into the vulvar tissue. So it changes the water content of the cells. It makes the irritated tissue less irritated, less dry, and it hydrates the area, versus lubricants act more of like a barrier in the vagina to decrease friction during intercourse, for instance. So lubricants are really only supposed to be used for vaginal penetration, whereas moisturizers are going to be used kind of every day to help with vaginal dryness one might have. So I want to go through the scenarios that we encounter that can be reasons why we would use a moisturizer or a lubricant. Scenario one would be perimenopause or menopause. So obviously this marks the end of our period. It's usually diagnosed when we've gone 12 months without a period. Perimenopause is that time leading up to menopause. So a lot of times there's a big hormonal shift going on there. But our ovaries are no longer producing estrogen, progesterone. So over time, that vaginal tissue gets really, really dry. It gets atrophied, leading to pain and irritation. So again, this would be one reason why we prescribe or recommend using a moisturizer daily. And then also a lubricant during intercourse. Scenario two, if you're a new mom, so you just had a baby, and obviously your body's going through a lot of hormonal shifts there with pregnancy and with postpartum. Again, changes in estrogen production, changes in progesterone. So, and then even with prolactin, which is a hormone when we start breastfeeding, basically it blocks estrogen. So when that happens, it's similar to menopause, where our vaginal tissue gets really, really irritated, very dry. And so this obviously can lead to many different scenarios, including decreased libido and so forth. So, a moisturizer can help with that daily dryness we might have, and then a lubricant is absolutely a must when it comes to transitioning back to intercourse after baby, to create that barrier so there's not as much irritation there. Scenario three could be, after having a surgery or cancer treatment. So like a hysterectomy sometimes can change that estrogen production. Again, same scenario with menopause. Similarly, it kind of can send women into an early menopause. Again, vaginal tissue gets dry, it gets irritated, it gets thin. So again, having a moisturizer daily and then sometimes a lubricant on board will be helpful. Chemo and radiation, same thing, tissue changes in the vagina and the vulva, and so that also is absolutely necessary for women after those treatments to have that moisturizer daily. Scenario number four, so other conditions that can, create pain or vaginal dryness. Birth control, sometimes taking a particular birth control can change the effects of the vaginal tissue as well because of that hormonal shift. It can change the amount of estrogen at the tissue. Again, like we talked about time and time again, that's again an issue with moisture and vaginal lubricant with arousal. There are certain pain conditions. One particular condition called vulvodynia, which causes really, really severe sensitivity to the vaginal tissue. With this condition, you want to be really careful about specific moisturizers or lubricants. But again, partnering with a pelvic floor PT is definitely necessary, and we can guide you in the right direction if this is, a diagnosis you've been told that you have. So I wanted to get to, moisturizers we recommend to our patients. I do not have, of course. Right now I don't have them in the clinic, but I will post a link in the comment section for all of these products that we do recommend to patients daily. So for a moisturizer, something even like coconut oil, very natural, very effective moisturizer. And this is something that you would use multiple times a day, depending on how dry that tissue is. So coconut oil can be really helpful. Obviously, a lot easy to come by. There's another product called V Magic. That's something you can find even on Amazon and some other websites, but that also has a lot of natural products in it. It's a little thicker, so it's almost like a balm, and that can also just help with that standard dryness that we're having day to day. Another product called Good Clean Love. They have a moisturizer and a lubricant, so that's a great company. I believe Target sells it offhand, but of course something that you can find on like Amazon or even our website that we have here at Legacy. And then another company called Sweet Spots Labs, Moisturizing Vulva Serum. Again, that's an online company that you can order through. So again, those are moisturizers. That is what someone would wear or have day to day or apply daily to help with the dryness that they have. Lubricants, again, this is something that is utilized during intimacy, during intercourse. It decreases that friction that we have that can cause a lot of irritation in the vaginal canal. So lubricants that we typically use with patients day to day, or that we even recommend for them. I do have one on hand, Slippery Stuff. So this is a water-based lubricant. And so this is something, as far as it's paraben-free, glycerin-free, ingredients are basically water and a few other names I can't necessarily pronounce, but this product is very, very safe. We really haven't had any patients that have had any issues with Slippery Stuff. So very, very safe, very water-based product there. Good Clean Love is another one that we talked about that is also water-based. Aloe Cadabra, again, water-based. There's a lubricant called Uber Lube, which is more silicone-based. So that one actually is still latex condom safe, so it won't degrade the latex condom. And then last, we recommend something called Foria Wellness. It's actually more of an intimacy oil, and it actually is CBD infused. So those of us that have pelvic pain conditions, that also can be really helpful for managing that. So anyway, so that is what I wanted to cover today, just kind of an introduction to vaginal moisturizers and lubricants and reasons why or scenarios that we might utilize that. And again, there's many different scenarios or different patients we might see where we come across where we're recommending different lubricants or different moisturizers. So if you are using a lubricant during intimacy, or you are using a moisturizer daily because your doctor told you to do so, or maybe you're going through menopause or you're in menopause, and if these products aren't working, I would look at different products that you can try. And again, I'm going to post a link that has what we recommend to patients to see if it's just the product might be better for you. Maybe you need a water base versus a silicone based or vice versa. So a lot of times changing up the product you're using, or even how often you are using it. So if you're noticing your vaginal dryness is still very much a problem during the day, it could be that the moisturizer you're using is not, you're not applying it as often as maybe you should be, which can then help with that dryness. And then last but not least, if these are concerns that you're still having, or you're having pelvic pain along with this irritation, definitely partner with a pelvic floor therapist. Again, here at Legacy, that is what we specialize in treating. We treat many different women from different walks of life, different stages of life that are having pelvic pain conditions. And we are happy to evaluate you and see what other treatments are effective for you.